everybody. This is Karen Lee Harrington with the Maine Health Data Organization, and I want to welcome you to our webinar this afternoon. We want to talk to you about some changes that I think many of you are aware of relative to Chapter 41 and a couple of other things. So I know we've got a lot of people who have registered for the webinar, and you may hear some beeping in, but I think let's go ahead and get started. I'm just going to kick this off by reviewing the agenda, and I think one slide after that, and then I'm going to turn it over to a colleague of mine, Kate Mullins with HSRI, who is our vendor that works with us in this process of collecting data. So again, we want to talk about changes to Chapter 241. We want to talk about the payer and LOS blocks. We think we have some news that will make many of you happy relative to those requirements going forward. Then also spend a few minutes talking about data validation, updates as a result of some of the changes to Chapter 241. We'll review the timeline of when these changes go into effect. We just want to take a couple minutes and remind on some data quality tips, and then open it up for questions. And we know you're all extremely busy, so we're going to just get right into this, hopefully end at 2 o'clock. But if there are questions that people have that go beyond 2, we're happy to stay on, and or we can follow up with people individually if that would be helpful. So with that said, Kate, if we can move to the next slide. So just quickly, and Kate will get into the changes to Chapter 241 in much more detail through this session. But some of the high-level categories of changes are some clarification of the language in the rule, some updated terminology, deletion of old information. We've updated the code list reference information, and then there's been some additions and some removal of fields. So again, we'll get into that. That's really the purpose of this discussion today, is to get into those things in more detail. And I think the important point here is that these changes go into effect with the submission of your, or beginning with the submissions of your Q1 2018 data, which is due by June 30th of 2018. So I know that sounds like it's way off into the future, but before we know it, right, we're going to get through winter and it will be spring again. So we want to start this conversation now. And with that, Kate, I'm going to turn it over to you and let you take it from here.
Great. Thank you, Karen Lee. Okay, so as Karen Lee mentioned, we're going to go over some details of the Chapter 241 changes. I think at this point, everybody has received copies of the new version as well as a summary of the changes. If you have not, just a reminder that this information is always available on the MHDO website as well. So first, we're going to start by talking about the new inpatient data fields. And again, this will be effective for 2018 data submission. So the first field is IP 2020, and it's a new field. The statement covers period from. And I will get into some more details about what that field means and what is expected in the next slide. The next set of new fields has to do with the patient. So we're trying to collect some additional information about the patient, including their country code, last name, first name, middle name or initial, patient suffix, and their address. And finally, you'll see that there is a new payer name field. We're going to be going into this in quite a lot of detail as we go through the presentation. But if you recall, the old payer name field was restricted to only allowed for 23 characters. That field is going away, and this new payer field allows for 100 characters, which should allow for everyone to submit the full payer name within their data files. And with this, we'll need some changes to, or the we won't need the payer crosswalk going forward. And again, I'm going to get into some more details about that. So the new statement covers period from field is the beginning date for the period covered on the record. And we're looking for that date to be in the CCYYMMDD format, which is similar to other date fields within Chapter 241. And the from date must be a valid date that is not later than the through date, which is IP 2013. And this slide just goes, lists out the fields that have, the inpatient fields that are being removed from Chapter 241. The payer identification number is no longer necessary since the new payer name field has been expanded to capture the full name. As I said, the old payer name field is being removed and replaced by IP 3009. And because of these changes, we've also removed a couple of the filler fields. Next, we're going to talk about the outpatient data field changes. And this is similar to what we just reviewed in inpatient. We are adding some new fields to collect patient information, including country code, last name, first name, middle name or initial, suffix, address, line 1 and 2, and there will be a new expanded payer name field. And again, that will allow us to capture the full payer name and remove the need for the crosswalk. The final field listed here is OP4006, which is the place of service. We're going to discuss that in detail on the next slide. So the place of service field is a CMS code that's used to indicate the specific entity where services were rendered for professional services. So this is something that would be on the CMS 1500. This field is mutually exclusive of OP4004, which is the type of bill and which is used for institutional services. And we've included a link to the code set, which is available on the CMS website. I'm just going to pull it up quickly here, and you can see that there's quite an extensive list that provides the code, the name of the service, and a description of that place of service. So again, that is available freely from the CMS website. In the outpatient data, we are also deleting a few fields as well, effective with the 2018 data submissions. Again, removing the payer identification number because of the expanded payer name field, and removing some of the filler fields because of these changes. So now I'm going to talk about how these changes are going to impact the payer and location of service crosswalks that people are currently submitting. So first I'm going to start off by talking about the payer crosswalk and review the current process and what the expectations are for the remainder of 2017. So submitters will still need to continue to submit their payer crosswalk for the payer identification number and payer name fields, which are IP 3004, IP 3006, and the same fields in the OP file. And so you'll still need to send that crosswalk with the 2017 data submissions when there are changes. And just, you know, I know a lot of you have spent a good number of resources in making sure that you're providing high quality payer crosswalks, and the information that we've obtained through those crosswalks has allowed the MHDO to better understand and report the data to users about the universe of payers being reported. So we thank you for all your efforts, and just know that we've been making good use of that information and are excited that going forward, we will be eliminating the need for those payer crosswalks because of the new payer name fields that I reviewed, where they're expanding from 23 characters to 100 characters and should allow you to submit the full payer name in the data submission layout. And as specified in Chapter 241, what we're looking for in that field is the full or unabbreviated payer name, not the plan name. So the next we're going to go talk about the location of service crosswalk, which is submitted by those of you that submit outpatient data currently. So the current process will remain the same for the remainder of the 2017 data submissions. When there are changes in the location of service information that you're providing in your submissions, we will be asking you to continue to submit those crosswalk updates to us. And in the future, we hope that we're sort of honing in on the goals for this information and reducing some of the burden for some of you. So the goal is that we want to allow data users to identify which services or encounters occurred at a physician practice in a standardized way, as well as to provide the name and location of the physician practice for more detailed analysis. So the users want to be able to filter out physician practices and identify them as EMC Family Medicine in Brewer, Maine Medical Partners, Portland Pediatrics, and Mercy Express Care in Yarmouth, for example. So the goal is really just focusing in on those physician practices and being able to identify their names and locations. We do not want to, we're not asking you to identify labs, hospital departments, imaging centers, or anything that would not be considered a physician practice. Based on the previously submitted location of service information, MHDO has identified approximately 150 physician practices, primary care, specialty care, and clinics within the hospital data. And it is the physician practices that we want identified in the LOS crosswalk going forward with the 2018 data. So with the changes to Chapter 241, MHDO is going to be minimizing the information required in the LOS crosswalks as a result of the addition of the place of service field. So the place of service field will allow users to filter out encounters at physician practices, and the location of service field with the crosswalk will provide the detail regarding the practice name and the location. So moving forward with the submission of 2018 data, when OP4006 is populated, which is the place of service field, with a subset of codes, which we've listed here, the LOS field must be completed, and the full name of the physician practice, along with the other information regarding its location, must be listed in the crosswalk that is submitted. So we have identified 7 place of service codes that we believe will identify physician practices. I'm going to go through those codes in the next 2 slides here, but we are looking for feedback if there are other codes that you will be using to identify your physician practices. We do want to hear your feedback. So the first one listed here is the place of service code 11, which identifies an office. So as you can see, the location other than a hospital, skilled nursing facility, military treatment facility, community health center, state or local public health clinic. So this is where health professionals routinely provide health examination, diagnosis, treatment of illness or injury. So I think we expect a high percentage of physician practices to be identified with this code. The next is the code 17, which is a walk-in retail health clinic. Again, this is where we may see some codes as well. Code 20 is urgent care facility, and it says specifically this is distinct from a hospital emergency room. It's an office or a clinic whose purpose is to diagnose or treat illness or injury for unscheduled ambulatory patients seeking immediate medical attention. The next code we have identified is the place of service code of 49, which is an independent clinic. So again, it's specifically saying it's not part of the hospital and not described by any other code, operated to provide preventative, diagnostic, therapeutic, and rehabilitative or palliative services to outpatients only. Code 50 is a federally qualified health center, which provides services for underserved areas and Medicare beneficiaries. 71 is a public health clinic. Again, we believe this might be an area where we're seeing some physician practice information. And finally, the last code we've identified is a rural health clinic. So again, this is the list that we've come up with in terms of where we believe there will be folks identifying their physician practices with these codes, but we do want to hear feedback regarding how you might be coding the physician practices in your data. So just in summary about what we're expecting in the future is that the data submitter must submit a crosswalk, as we're going to go over a template that shows exactly what will be in that crosswalk. And again, this will happen when place of service is coded with one of the codes that we identify, and the LOS code field must be populated, and the accompanying crosswalk must be submitted. And unless there are changes to what has been submitted in the data, the crosswalk only needs to be submitted annually. So here's a template for the location of service crosswalk that will need to be supplied when those criteria I just reviewed are met. We will be providing this in an Excel format if people want to make use of that for their submissions going forward. So we want to have the first column will be the LOS code that is being used and populated in your data submissions. The second one will be the location name, some address information, and NPI if it's available. And this slide just summarizes the description of the columns we're expecting. Again, we're looking for this information to identify the location of where the services are performed for these physician practices. Okay, so next I'm just going to briefly go over some information about how these Chapter 241 changes will impact the data validations. We will be making some updates that will be effective with the submission of 2018 data. So in the inpatient file, there will be some additions and removals of validation rules to accommodate the Chapter 241 changes. So, for example, for the fields that have been removed, we'll remove the associated validation rule, and we'll be creating new ones for the new fields. And I think, there shouldn't be any surprises there where, as far as the new fields, there'll be similar rules to what you've seen in the past for other fields. We will also be making some changes to the rules that are performed on the ICD-9 fields. At this point, we're not seeing any ICD-9 codes coming in those fields with the more recent data, so we're going to be modifying those rules to no longer expect ICD-9 data. And in the outpatient validation rules, again, we'll be making some additions and removals of the rules to accommodate the Chapter 241 changes. And we'll be adjusting the logic for the location of service field to accommodate the new approach for the crosswalk in conjunction with the place of service field. We will be providing a detailed list of what those changes will entail, and we'll be distributing that by the end of December. So at the same time that we're implementing the Chapter 241 changes, some validation changes, we'll also be doing some other annual updates. For those of you that have existing profile and exemption overrides through the end of, those will be good through the end of the 2017 submissions, but with the start of 2018 data, we will be resetting existing profile and exemption level overrides. Submissions that occur after that reset will be evaluated against all the validation rules as if you have without any existing overrides, and new overrides will need to be submitted based on the validation results. Next, I'm just going to go over the timeline for all of these changes that we've reviewed and talk about the opportunity for you all to do some testing. So that's the first item here. We will be giving the hospitals the opportunity to test all of the Chapter 241 and validation changes in a separate test portal beginning on February 1st and running through the end of that month. And then the second item is just a reminder that Q4 2017 data files are due in the old Chapter 241 format by the end of March 2018. And that last day in March is the last day that files for any period will be accepted in that old format. Files submitted between April 1st and April 3rd will be held while we implement the Chapter 241 changes, and will be processed on April 4th once those changes have been deployed in our production portal. And on April 4th, hospitals are welcome to begin their submissions of their newly formatted Chapter 241 files. So this will be the Q1, starting with the Q1 2018 data, and they will also be able to start submitting the new LOS crosswalks if applicable. And again, this is when the annual override resets will be occurring as well. So all of these changes will go into effect in the production portal on April 4th. We will also at that time be asking folks to review their registration information, and that sort of constitutes, reviewing all your users, your contacts, and some other information that we collect in the portal to make sure that is up to date, and since we rely on that information to communicate with you all, I'm just asking you to take the time to review and update that information starting on April 4th, and we'll be asking you to complete that by the end of April. Finally, we just wanted to take this opportunity with you all to provide a couple of reminders based on some information that we've seen and feedback we've heard from the data users. We just wanted to make a note here about the data should, we're hoping to see a high population of the patient discharge status field in the inpatient file, so IP 2014. This is something we've seen an issue with in the past, and really want to just put some emphasis on making sure this field is populated. And again, going back to the validation changes that we'll be implementing with the 2018 data, at this point we're really not expecting to see any ICD-9 fields populated in the inpatient file, so that's the 70 record constitutes all of those fields. We're expecting those to be blank at this point. And Carolee, I think I'll turn it back over to you.
Okay, thank you. So I think at this point we wanted to open it up for any specific questions that folks might have. And Kate, I don't know if lines are muted or...
Come on in.
Okay, so does anybody have any questions with what we've just presented or any other topic?
I have a question.
Yes, go ahead.
Regarding the location of service crosswalk, has it been asked if OP 4005 can be completed with the data regardless of OP 4006 code that's used? I'm just thinking from a programming standpoint, it may be easier to list all of the data rather than only populating it for particular place of service codes.
And is that Katie? I just saw your chat as well.
Yes, that's this.
So yes, I think that would be fine. That you could populate that LOS field regardless of what whether the place of service is on the list that we're identifying as physician practice. Because you are using that place of service field, we'll still be able to filter out, you know, what users are trying to target here. So I think that's fine.
Thank you.
Thank you, Katie. Are there any other questions? Okay, well, I hear a lot of people are, I think, getting off the call. So,
Carolee, I do see there were a couple of people who submitted some questions via the chat feature, and I do think there's a few that we may need to do some research on before we respond, but there is at least one here that I can just respond to here. So the question is, when does the LOS crosswalk need to be submitted? Is it in advance of the Q1 2018 data, and how is it submitted? So the crosswalk will be submitted. It needs to either be like as an Excel or CSV file that is sent to the MHDO help desk. We then evaluate it and load it to our database so that it can be used in the validation of your data submissions. So it would be helpful to have that submitted to the help desk before you submit your Q1 2018 data, but we can work back and forth together as needed in making sure everything lines up there. And going back to the template that I provided in the presentation, there was a table. We will provide an Excel version of that people can use to build their crosswalks. And then the other question I see, just a more general question, is just that this presentation has been recorded. It will be made available on the MHDO website, and the slide deck is going to be available on the MHDO website as well if it isn't already. So we can send out that information.
And Kate, can we also, we'll follow up with an FAQ based on the questions that we've responded to on this call and the ones, Kate, that you're saying we got via chat, but we need to do a little research.
Yes.
So we'll post those as well. The deck is already up on the MHDO website, but we will also include an FAQ as a follow-up. All right, Kate, are there any more questions via the chat feature?
No.
For the folks that are still left on the line, are there any final comments, questions? Okay, hearing none. Thanks, everybody. really appreciate your time, and do not hesitate to reach out to us if you have any questions as you work this all through. Thanks a lot.
Thank you.